Good day, I am Markeisha Chloe Limyak, and for today, I will be demonstrating the proper procedure for application of cold and hot compress. First, I will identify and verify the client's identity, including the full name, date of birth, and the IT band. Next, I confirm the physician's order, review the client's medical history, and chart. After, I inspect the skin around the area to be treated, check for redness, cuts, swelling, or bruises. I also check the client's ability to feel the temperature and pain to make sure they can report any discomfort. The expected outcomes of this procedure is to reduce swelling, ease pain, lower inflammation, and prevent further tissue damage. Next, I gather all the needed supplies and arrange everything neatly at the bedside. Next, I'll explain the procedure fully that we will apply a cold compress to your affected area for 15 to 20 minutes. This will help ease pain and swelling. I'll help the patient sit comfortably. I keep the affected body part aligned and supported, exposing only the area we will treat and keep the rest of their body covered. I place the compress gently over the affected area, molding it closely to the body part so it fits well and covers the whole treatment site. I will also check the compress every 5 to 10 minutes. I'll also check the client's skin at regular intervals. I will look for pale, blanched, or very red skin and ask how the area feels. If the client reports severe pain, numbness, or if I see any skin changes, I will stop the procedure immediately and inform the nurse or the doctor right away. When the 20-minute treatment is complete, I'll carefully remove the compress. I'll dispose of my used materials properly, remove my gloves, and perform a hand hygiene again. I'll help the patient return to a comfortable, safe position in bed. I inspect the treated area again, compare it to before the procedure, and check how the skin responds to touch. These tell us if the therapy is working well. I'll check for any unusual reactions, such as increased redness or skin irritation, and record these details. Finally, I'll document all important details: date, time, type of cold therapy, body part treated, temperature used, skin conditions before and after, and how the client tolerated the procedure, and any concerns to report to the healthcare team. Next, I'll demonstrate the proper safe procedure for application of hot compress. For the first step, I'll verify the client's identity using 3 identifiers, including the full name, date of birth, and medical record number. Next, I'll verify the doctor's order, including the type of moist heat application, exact body part to treat, and the duration of this therapy. I carefully inspect the skin over the area we will treat, checking for redness, wounds, swelling, or irritation. I'll also test the client's ability to feel heat and pain so they can tell me right away if it gets too warm. The goals of this procedure are to relax muscles, improve blood flow, reduce joint stiffness, and help drain infected areas safely. I'll stay with the patient for the first 5 minutes, and if the client reports burning or if I see blistering, pale skin, or pain, I'll stop the procedure immediately and inform the healthcare provider. After 20 minutes, I carefully remove the compress. I inspect the treated area closely, check for redness or irritations, and gently test how the skin feels to touch. I'll also check for any unusual reactions like increased swelling, blisters, or dizziness, and record these details. I'll document all important information, including the skin condition, before and after, and how the patient tolerated the procedure. And this completes the proper demonstration for application of cold and hot compress.